people failed competencies last year because they didn't use a water trap. So you have your blue tubing that comes off the nebulizer, or the large volume nebulizer, the blue corrugated tubing that goes here. Then you have another piece go right here, and this goes out to the face mask or whatever it is that you have hooked up. But this should be in the middle somewhere of the blue tubing.
Okay.
So all the water, you get a lot of condensation from that large volume neb, and all the water builds up in the tubing, and you drain it into here. And you got to make sure when you first open this, when it's opened like this, you want to make sure that that's closed when you set it up on a patient, because if it's open, it just leaks out. Yeah, so that's how you drain it. So make sure that's closed. There's two different kinds of water traps, but they're the same thing. I guess this is the only one we have here. I don't know. There's another one that has the same connections, but it's like a plastic bag on the bottom, but it's the same thing. So just make sure you use that.
Okay.
And,
do you know how we're going to be setting it up? I mean, what is the
Jay does it. I'm not sure how he has you guys do it. I think he just has like the nebulizer, tubing, probably this, and everything laying on a table, and you just set it up from scratch.
Okay.
Yeah, I'm assuming that's how he does it. I think that's how he did it last time. So.
How do we set that up with the neb though? Like.
So you have the neb connected to. He's probably gonna have like a big H cylinder down there, and you're gonna connect the neb to the flow meter, right? The large volume neb, and then you're gonna have a piece of blue corrugated tubing come off the neb, and it just slides right onto here. Yeah.
Okay. Is one supposed to stay open?
One of these?
Yeah.
No, because you have
screws on
the piece
to
comes from the neb to this piece.
flow meter.
Then you have another piece come from
and
here
then
off,
on
which
here
is
it
connected
tells
to
you
the face mask
what your setting should be flow wise.
Oh, okay.
But this is just in the middle of the two pieces of blue.
So
tubing.
this would screw in, right? You don't see it?
I don't see it.
That's
I don't get these.
Yeah.
I don't.
What don't you get?
I just don't get anything about them.
Them? All of them? Competencies?
No, just the large volume nebulizer.
They're simple. Here, look. Do you have any blue tubing at all anywhere? No.
But like, when would I know? How do you know when to use a large volume nebulizer?
Well, if you're putting someone on a cool aerosol mask, you need cool aerosol, right? So that's a large volume neb.
Okay.
If you're putting someone on a trach collar, they need humidification. That's a large volume neb. A face tent, you need a large volume neb.
Would you check for oxygen too?
I'm not sure if they use that for oxygen. I don't work. I've never really worked with like pediatrics, so I'm not sure. Yeah, there you go. So obviously these should be longer, but maybe like that, right?
Okay.
This one will be right here, and then you'll have your aerosol mask, face tent, tray collar, whatever it is that you want. And this should be somewhere in the middle, and it's usually like on the floor somewhere. You still usually have to like manipulate the tubing a little bit to drain the water out into this. Like I said, just make sure that this is closed, yeah, or else you're gonna. Not only do you get water leaking on the floor, they're losing flow because it's just leaking all out of here.
Okay.
What should be the flow
It tells you on here. Actually, this one doesn't, but usually just flush it. Like 15, well, I can't turn it on now, but 15, I would just flush it. We usually always just flush them where I work anyway. But there are some that actually have a little thing on there that will point to the liter flow. Like a Benny mask tells you, it will say like 30% is whatever. So I would just flush it. Check your notes. I don't know if Jay has anything specific
He said 10
that he wants it on. Yeah, so 10 to 15.
And we should see the mist.
Yeah, he should be able to see it. Yeah.
Alright.
All right.
Thanks.
Good. No problem. Where did I get this from? This wasn't in your box, right? Oh, okay.